Dear friends, I welcome you all to this auricular therapy. In today's class, we are going to see about the anatomy of this auricle. This auricle is nothing but the outer part of this ear. The outer portion of the ear is called as auricle. So that's why we call it as auricular therapy. And this auricular anatomy is what we are going to see today. We are going to see 13 important structure parts of the auricle. 13 important structures of this auricle. Let's see in detail one by one. The first thing is called as the ear lobe. The ear lobe is nothing but the lower part of the ear, which is very soft portion, which is marked in red color on this picture. This is called as the ear lobe. This is the first anatomic part. The second one is called as helix, the outer prominent rim of the auricle. This is called the helix from here to here. This portion, the orange color or yellow color, what is? This is called as the helix. And the inner portion, the end of the helix is called as helix crush. Helix crush is the inner portion which is connected to the helix. The next portion is antihelix. The antihelix is the elevated ridge anterior and parallel to helix is called as the antihelix. The antihelix. This is the inner portion. It's called as the antihelix. And from this antihelix, there are two branches. Two branches. One is superior antihelix, and the other one is inferior antihelix. The, the space between the superior antihelix and inferior antihelix is called as triangular fossa. Triangular fossa is between superior antihelix and the inferior antihelix is called as triangular fossa. Next one is called as scapa. The narrow curved depression between helix and the antihelix is called as scapa. Helix and the antihelix. In between the portion is called as the scapa. This is called scapa. Scapoid fossa is called as scapa. The green portion, the dark green portion is called as scapa. The next one is tragus, the small curved flap in front of the auricle. This portion, the hard portion, this part of the ear, you will have a hard portion. This portion, this will be a very hard portion. It is called as tragus. This is called tragus, and opposite to that is called as antitragus. Tragus and the opposite part is called as antitragus. And the portion in between these two, tragus and antitragus, is called as intertragic notch. The portion in between tragus and antitragus is intertragic notch. And the next portion is Simba and cavum cocha are the last two portions, which is the bigger portion. This portion is called as the Simba cocha, and this portion is called as the cavum cocha, which is connected to the internal ear, which is connected to the inside part of the ear. Simba cocha and cavum cocha. So there are 13 important structures. The anatomic portion of the ear is divided into the outer portion of the anatomy is it's separated into 13 parts. So all these parts are we have seen in detail. So you have to remember all these parts. You have to see this picture again and again, and you have to remember when we start giving treatment, we will be telling that you have to needle. This portion is in Simba Kocha. This portion is in helix. This portion is in anti-helix. So you have to remember the technical names, the anatomic names, so that it would be easy for us to discuss when we give treatment, when we learn for the treatment portion. So make sure you remember all the 13 points are very simple and very easy to mug up and very easy to identify. The main part is you have to identify this 13 portions properly. Only then we will be able to use this in the treatment. So hope you would have understood very clearly about this class. We will meet up in the next class. Thank you. Bye.